Okay, this video is who is the best atrial fibrillation doctor? Okay, and I'll tell you where this is coming from. Well, first of all, I'll show you a couple of these doctors. Here's William Hucker, MD, PhD, cardiologist, electrophysiologist over at Harvard, MGH, Massachusetts General Hospital, man's greatest hospital is what it calls itself. Here's Robert Fischel, EP, electrophysiologist, cardiologist over in Florida. Here's John Day. John Day, by the way, is a pretty famous guy. He's the author of this best-selling book here called The Afib Cure. And I'm just about done reading it. It's a good book. I think it's an excellent book on the procedure of ablation, like pulmonary vein isolation for treatment of atrial fibrillation, where they burn holes in the heart, burn holes to destroy the cardiac tissue that's generating the abnormal rhythms, typically coming from the left atrium around the pulmonary vein. So that's called pulmonary vein isolation, PVI. And that's the standard treatment for paroxysmal atrial fibrillation that goes to the catheter lab. Okay, so I had been around these guys. I did a fellowship at Harvard in vascular interventional radiology, and we used to scrub on cardiac cases, and we used to hang around with the EP docs, okay? And Harvard's pretty much known for a lot of cardiac stuff. Okay, I tell you that because the way these guys work is they do a lot of EP procedures. You know, he's done thousands and thousands of them, and they'll publish papers. He's actually published a lot of papers on them, and he knows a tremendous amount about that. He was one of like the leaders of the Cardiac Rhythm Society and all these other things, the electrophysiologist journals and whatnot. Okay, but I'm making a point. Patients tend to get too dazzled by the bells and whistles. The real question is, how can I get better? How can I cure myself? And that's where I'm going to tell you that I think even though this is the best-selling book on atrial fibrillation, and it really does a great job talking about the cardiac ablation procedure where they place a catheter into the heart and ablate the tissue around the pulmonary veins to prevent reentrant arrhythmias from causing atrial fibrillation and abnormally fast heart rates that don't generate enough pumping of blood. Okay, so it's great for that. And it's real good discussion of the medications too. So this is a valuable book. However, there's a problem with this book where it becomes a joke. He recommends like the DASH diet and says it's okay to eat fish and nuts and other stupid things, okay? So he really doesn't know what he's talking about with nutrition. Even though he speaks Chinese and he went to China and visited some healthy old people, he doesn't know what he's talking about with nutrition. And what I'm saying is what you really want, if possible, is to prevent yourself from ever having atrial fibrillation. Atrial fibrillation kind of reminds me of the H.G. Wells book and movie, The Time Machine, where the sort of passive, wimpy people like modern stupid Christians are walking around in a daze thinking everything's fine, and they get dragged down underground by the Morlocks, these sort of evil, sinister people that then eat them as cannibals. And what I mean by that is AFib can destroy your life very fast. With atrial fibrillation, about 15% of people are dead in 1 month, according to one paper. Another paper said 25% of patients, if they're over 65 years of age, they're dead within 1 year with atrial fibrillation. So it can kill you pretty quick. And by decreasing the perfusion to your brain, it can cause cognitive decline pretty quick. So it's a serious condition. And what I'm trying to say is prevent coronary artery disease, prevent ischemia of the heart, and you've got a very good chance to prevent atrial fibrillation. What are the most common causes? Patient's fat, patient has hypertension, patient has diabetes, and they smoke cigarettes, and they're sedentary, and they're stressed out. That sounds like a typical American, okay? So just don't do those things, and it's very easy to do. And what I'm trying to say is the low-fat, low-sodium vegan diet's 1,000 times better for keeping the coronary arteries open than all this DASH diet, Mediterranean diet nonsense, okay? Another thing that can cause atrial fibrillation is mitochondria inhibitors. Okay, by the way, I'm going to give you a link to each one of these guys so you can watch their videos if you want to learn more about atrial fibrillation, and they're all very good. He's just going to give you a basic, quick outline summary overview, so it's quite good, and he's got some good illustrations. Robert Fischel is an hour-long video, and his I thought was pretty neat. He shows in the cath lab a procedure being performed. They puncture both groins with several sheaths. They also have to go up through the inferior vena cava into the right side of the heart, and they have to puncture across the atrial septum. They do it at least twice for each case, and then they go into the left atrium and they ablate the tissue around the pulmonary veins, all four of them, because those are the most common source sites for the arrhythmia of atrial fibrillation. So it's very cool. He shows you how he does it. And if you're going to, have atrial fibrillation, first of all, I would say try to fix the problem. Avoid all the stimulants, avoid the caffeine, get your sleep, get your mild exercise. Don't be a marathon runner. They get increased Afib by a large margin, or a triathlete, okay? Just a reasonable amount of exercise. Walk for about 1 or 2 hours every day, something like that. But if you're going to go for an ablation procedure, you want to go to a place with lots of experience. Doctor who's got lots of experience. He's not on call the night before your case, so he's well rested. He's got his A-team of nurses and techs working with him. He's going to actually do the case. He's not going to turf the case to the junior fellow who doesn't know anything. The place does a lot of volume, so everybody in the room has a lot of experience, hundreds of cases per year. Cardiac surgery perhaps available on backup in case there's some complication, injury to the esophagus or something. Latest equipment like a force sensing catheter so they know they got contact with the heart, a burn sensing detector so they can confirm they've got true isolation and they haven't just stunned the myocardium. And then do they have the latest equipment? There's different types of electroporation. There's radio frequency ablation, there's cryoablation, etc. And you want to make sure they've got good state-of-the-art equipment and a lot of experience with it. However, what I was kind of joking, so I was a bit of a joke here. So the joke is that these guys are all famous and excellent at electrophysiology, all right? But I've never met a cardiologist who could intelligently discuss diet, okay? I'm sure a lot of them probably know because a lot of them are pretty skinny and healthy looking, and they don't want to get a stent in themselves. But the McDougall diet, Esselstyn diet, my Spartan vegan diet, all of this stuff is much, much better than anything these guys I've ever heard a cardiologist say about keeping your coronaries open, avoiding obesity, diabetes, hypertension, insomnia, etc. All those things will help from and being stressed out. Also, I'll talk about religion. They're all scared shitless to ever talk about religion. So they say yoga. Yoga's BS. Stand in front of a wall and go, Om, like that's going to make your life better. No, say, hey, Christ, I'll do the best I can with the time I got left, okay? All right, so anyways, I will put a link to each of their videos. I hope you find it helpful. I'm currently in the process of studying atrial fibrillation some more because it's very interesting and it's very common and the incidence of it is increasing quite a bit. And I think, I'll go into the reasons later, but I've already made several videos about it, but there's more to say about it. It's actually quite interesting.